Hello, doctors. Today we'll be discussing back pain. Let's start with the simple abbreviation. We use it when taking history from patient presenting with the pain. First of all, we will start with the O, like onset. So we should asking the patient about how the pain started. Is it suddenly or gradually? After that, we should also asking about the setting will help us to determine what the patient were doing when the pain started. Maybe the patient were lifting heavy objects, so it's very important to asking about the setting when the pain started. Also, it's very important to start asking about the cause, like is the pain getting better or worse or the same. Next one will be F. So F will be for frequency. So we'll be asking how often do you feel the pain or the pain if the patient getting the pain frequent, like we can also asking how many time like the patient getting the pain in a week. After that, the main the duration. So we'll be asking for the how long does the pain last each time? Is it changed from the first time? The next P will be for position. We will be asking the patient if they can point the pain or show us the location. The next Q will be for quality, if we can ask this question to the patient so can help us to determine the source of the pain. We can ask him if you can describe the pain or how the pain does feel like. Is it sharp, throbbing, or any different kind of the pain? Next R will be for radiation. This is very important things when you're asking about the pain. Some pain could originate in different places and shooting into different places as well. Like in pancreatitis could present with abdominal pain, but also could radiate to the back. Coming here to another S, it will be for severity. So always during the taking history, we should ask the patient if they can rate this pain for us from the scale 0 to 10, and the 10 will be the severest one. Also here coming to T, so T will be for timing. So here we should ask the patient, is the pain worse more in the morning or the night or after certain activity or after certain duration? Coming here to the last 2A, so first one will be for aggravating factors. So here we can ask the patient if the patient noticed something make the pain worse. And also another A will be for elevating factors. So here we'll be asking the patient if they did something to relieve their pain, if they did certain position or they take certain medication. Coming here to the most important part during our history taking, and will be the constitutional symptom and trauma. Always when you are taking history, you should ask about that, like fatigue, weight loss, night sweats, and also we should ask about recent trauma. Because most of the patients present to the emergency department with back pain, most of them will be due to trauma from like heavy accident or could be from minor thing like coughing if the patient has history of the cancer or could be metastasis. And also it will be good idea during constitutional symptoms when you ask about constitutional symptom, asking about general health or maybe asking about appetite. Coming to associated symptom, we should start asking if the patient experiencing any weakness, numbness, or tingling, or if they have any balance difficulty. And also very important to ask if the patient lost bowel or urine involuntary. And if the patient man, we could also asking about the erection difficulties because that could affect it in the certain kind of the back pain. If the patient was saying yes, he has weakness, balance difficulty, or numbness, this could indicative of the code equina syndrome, and this is considered an urgent condition necessitate urgent referral to the hospital or some center they can deal with such kind of the condition. Here we reach to the most important part. Like past medical history, here we should ask if the patient has been diagnosed with any medical condition such as prostate problem or cancer, because this back pain could be a result of the metastasis. Also, we should ask about the prostate screening, would also give us good idea of the patient visiting healthcare provider regularly. Also, we should ask about the drug allergy, and the patient is female. We should always ask about last menstrual period, because in the certain kind of the um, gynecological disorder, the patient can present with the back pain as a result of the menstrual period complication. So it's good idea always to ask about last menstrual period, and also we can ask the patient always complaining of this pain during the menstrual period. Coming to the family history, we should also ask about any kind of the cancer in the family, specifically the bone cancer, prostate cancer, and general condition runs in the family. Coming to the social history, put in your mind always sad word. So when you are taking your history, you should always write this in your notes so it can easily remind you about what you have to ask. So S will be for smoking. So you should ask about the number of cigarettes and for how long the patient have been smoking. And also if you have time during your history taking, you can just offer the patient interested in the quitting smoking. Coming to alcohol, we should also ask about alcohol, the patient drinking alcohol, which kind of the alcohol, and for how long. And as I mentioned before, if the patient um, interesting in the alcohol quitting, we can also offer appropriate social resources that can help the patient quitting alcohol. We can do this counseling for smoking and alcohol cessation during our history taking if we have enough time and the patient not in the pain. Also here coming to the last one will be D. D will be for a drug. So it's very important to ask if the patient use any kind of the drug, specifically the intravenous drug, because also this can cause some kind of the infection in the bone. So it will give us good idea of the patient using heroin or other kind of the drugs that can cause this back pain. Specifically, if the patient during the history taking they have positive constitutional symptom, so this also could be one of our differential diagnosis, intravenous drug use. Also, coming to this occupation and support, it's very important to ask about occupation because the patient could be working in the factory or any other fields. They may be hefting heavy objects or their job necessitates doing some hard things. They can cause this back pain. So it's good idea to ask about the patient, like what do you do for a living, and also always make it a habit to ask about the support. How do you support yourself? Do you get enough support? Also, if you have time, you can ask about the mood. Just make the conversation more uh, like engaging. So try to engage the patient. So this will help the patient to answer your question, and specifically if the patient like teenager, so this will help you to build a relation with the patient. During our history taking, if you heard any pain word of the patient in the pain, always ask about the coping strategy. Like, how do you cope with this pain? Do you get enough support? And also, the patient living alone, you can ask about daily activity, like, are you able to do that? And also, some tips can help you during your history taking. You should always be empathetic, showing empathy, be kind even you are in a rush, and also when you're asking the patient to show the pain side, always stand up and look. Don't just nod. In emergency situation, also it's a very good idea to ask for help from your colleague or the nurse if you are in a rush or maybe you are not able to manage this condition. Always asking for help is good option. So we reach to the differential diagnosis. So we'll start with the osteoporosis because osteoporosis can cause acute pain if the patient has a compression of fracture. So there is some hints can help you to diagnose osteoporosis. So in compression of fracture, the presentation will be acute pain, no constitutional symptom like fever, arthralgia, other things we talked about previously, and the patient will be telling you, I'm not able to move, or if the patient able to move will be very painful to him. And regarding osteoporosis, most common population affected will be postmenopausal women because estrogen level will be decreased, so that was also will affect the bone strength. And also here, the most type of the fracture will be vertebral compression fracture. And most common symptoms, it could be different. It is depend on the fracture side. So we cannot talk about that because if there is in cervical can present with neck pain or lumbar or sacral could present it with the back pain. Also, there is a lot of the cause that can cause secondary osteoporosis that can lead to the fracture, like glucocorticoid and heparins. So it's good idea always during your history taking in the past medical history to ask about any medical condition the patient has been diagnosed with, or if they take any medication that can help you to diagnose secondary condition like secondary osteoporosis. Let's continue our differential diagnosis related to the renal stone. Regarding the duration, there is a lot of the variation. Some patient can tell you I have pain for 1 day, some they can tell you I have pain for 3 days. Regarding the character, sometimes the patient can tell you the pain is increasing or decreasing. Regarding the associated symptom, this is good symptom you can ask during your history taking if you suspected the renal stone, like nausea and vomiting, change in the urine color, if there is blood, and also most of the patient they will tell you I have pain in my thigh if the cause of the back pain will be renal origin. It's a good idea also to ask about dietary intake in the general with focusing on the calcium because some hypercalcemia can cause renal stone. Secondly, we reach to the herniated disc also can cause acute or chronic back pain. Pain can radiate below the knees. Some patient that can tell you I feel the pain in my toes. And also if the herniated disc compress the nerve root, the patient can present with the numbness, tingling, or weakness, and this considered an urgent condition. Last one will be osteoarthritis. The character will be activity-related pain. Regarding the timing is very important. So the patient feel the pain worse in the evening. And if the patient has stiffness, the stiffness will be less than 15 minutes. If you suspect osteoarthritis, you should ask about risk factor like obesity, age, occupation, because in the certain occupation, there is joint overuse that can cause osteoarthritis. We reach to the seronegative arthritis that can also cause back pain. Regarding the stiffness, 90% of the patient will having this stiffness lasting more than 30 minutes. The pain pattern improve with the activity, but worse with the rest, not like osteoarthritis. So always when the patient doing activity, they will feel better. Let's start with our differential diagnosis for seronegative arthritis. We'll start with ankylosing spondylitis. This patient can present with the back pain, and most of them they will be around 25 to 27. The back pain will be worse at the night as we talk, better with movement, often affect young men with lower back joints. Second one will be psoriatic arthritis, the joint pain with the skin on nail psoriasis, finger or toes may swell like sausage. So if you suspect any seronegative arthritis, always don't forget to ask the patient to see his or her hand to get better idea if they have any skin condition. Enteropathic arthritis will be joint pain due to the bowel disease like Crohn's. It can affect the spine and other joints. So always in past medical history, it would be a good idea to ask if the patient has been diagnosed with any medical condition so you can have this connection in your mind and could you relate the symptom to each other. Last one will be reactive arthritis after UTI or stomach flu, so joint pain after infection as we talk, that can cause eye redness or painful urination. Coming here to the cancer that can also causing back pain, specifically if the patient present with a fracture. So the character of the pain could be continuous pain, specifically during the night and also during our history taking of the constitutional symptoms like weight loss, fatigue, night sweats will be positive. That will be good indication that could be cancer or infection. So most common secondary spread metastases that could from the prostate, lung, colon, or breast. So during our history taking, it's good to ask about prostate screening, if the patient has been screened for lung cancer, colon, or breast. When you are taking history, always write down your notes and ask about eyes. The eye will be for idea, so you can ask the patient, what do you think the cause of this pain? Do you have any idea? Coming to the C will be concerns. Do you have any concern? Do you have anything you want to tell me? And also coming to E about the expectation, you can ask at the end of your history taking about what is your expectation today, what we can do for you. Coming here to the multiple myeloma that can also cause back pain. So during your history taking, you will find the long-standing back pain that come and go. Possible signs like recurrent infection, anemia that can cause fatigue, pallor, and others anemia symptoms, history of the kidney stones, and also the patient can tell you I have a frothy or foam urine, or they can tell you I have just bubbles in my urine. So if you are suspecting multiple myeloma and you have post-encounter and they ask you about the investigation, so MRI of the spines will be the first option. We always ordering this things for patient presenting with multiple myeloma or we suspecting multiple myeloma. Also blood test, it's good to start with the CBC, calcium, because as we mentioned, this condition can cause anemia, so it's better to get the ferritin, hemoglobin level, and also can cause kidney stones. So it's good to order some calcium and creatinine because also this condition can affect and compromise our renal function. Coming also to another kind of the investigation is very important to diagnose multiple myeloma. It's called urine protein electrophoresis, Benz-Jones protein, and also serum protein electrophoresis. We're gonna find something called ameprotein spike. This is very rare condition that can cause back pain, but it can come in your exam, and also it's very important topics, so you should always read about it, go to Toronto Notes, read more about it. Coming to the spinal stenosis, the patient will present with a chronic back pain for long duration. Most of the patient, they will tell you the pain radiate to the legs, often bilaterally, and they improve with the leaning forward. This very, very, very important. So just keep it in your mind. If the patient tell you during the shopping, I feel better because they are leaning forward and they're bending forward, so that could be good sign that condition could be spinal stenosis. And also the pain will be worse with the back extension. So during the walking or standing upright, the pain could be worse. Coming to the rheumatoid arthritis, the kind of the chronic pain can cause pain or discomfort that affecting the cervical spine more than lower back. Here, the morning stiffness lasts more than 30 minutes, improve with the activity, not like osteoarthritis. Regarding the inflammatory feature, because in rheumatoid arthritis there is inflammation, as we talked before, it's worse in the morning or after a period of the rest. There's a swelling, warmth, tenderness of the affecting joint, and this most likely will find it in the if there is hand joint affected, so you will find this. But in back pain, it's very difficult to feel the swelling or warmth or tenderness. And also the patient will be presented with fatigue, low-grade fever, weight loss. So it will be good for you if you're asking about constitutional symptoms and trauma during your history taking. And also put in your mind if there is any neurological symptoms, significant spinal deformity, or systemic signs that suggest complication. This could necessitate urgent referral to the hospital or urgent consultation or referral depending on the situation and the condition of the patient. If you suspect the back pain could be related to the abuse or psychological concern, there is something to put in your mind. The abuse is not related to the gender, not related to the age. If your patient appears sad, anxious, withdrawing, and you suspect there is abuse or depression, let's start taking it from abuse. So if you suspect that, you should start asking about the mood. How have you been feeling recently? You should also ask about the safety. Do you feel safe at home? If there is anyone live at home, if she get enough support, and also very important to ask about the children, if there is any children at home, and if are they safe. Also, asking about hospital visit without a clear explanation or cause, that is very important. If there is any fracture, if there is any medical condition the patient has been treated for. Also, it's very important to ask and clarify if there is any history of the trauma, if there is any history of the intimate partner violence, or there is any history of the police, like the police before intervening between them. We can also ask if the patient alone during the visit, because some patients they feel not comfortable talking if there is the abuser is sitting outside or the partner. So it's good idea to tell the patient you are safe here, no one will hurt you, you can talk, we can call the police if the patient want that. Always ask the sensitive question in the private. Make sure and when you start the conversation to talk on the private setting in non-judgmental, empathetic way. Always when you are suspecting abuse, um, offering calling police, offering social services like shelters or anything the patient could need it in this situation. Also, we can refer to the mental health if there is any concern, because some patients they exposed to the abuse they could have post-traumatic stress disorder. So that could be also good if we can refer the patient to the mental health provider. Let's summarize here. So first of all, we'll start with this abbreviation so we can get better idea about the pain quality, site, radiation, and other things. After that, we'll ask about constitutional symptoms like fever. So if that's positive, could be infection or cancer. Also very important to ask about the trauma. Coming to associated symptoms like weakness, numbness, if that positive could be called equine syndrome, and that necessitate urgent intervention. Coming to past medical history, it's very important to ask about history of the cancer, any medical condition, drug allergy, and screening for prostate, colon, and lung and breast cancer. For family history, we can ask for if there is any similar condition or similar symptoms, and also very important to ask about history of the cancer in the family. Regarding social history, always will use SAD for smoking, alcohol, drug, and remember to ask about support. So support, we can ask about how do you support yourself? Do you feel safe in your relation? All this question is very important to ask. Don't forget to use ice during your history taking. I for idea, C for concern, E for expectation. Thank you for watching. If you like this video, don't forget to support us with like and subscribe. With love and support, Dr. Sabri. See you in next video.